very much. This is a very important continuation of Vermont's leadership. And we're here today as the three of us from the congressional delegation are heading back to Washington and actually having a debate about repealing the health care reform bill. And as Senator Leahy and Senator Sanders have both mentioned, there are incredibly important reforms in there, particularly insurance reforms, that make a real difference to real families in this state and throughout the country. And why anyone would want to throw everything out when it admittedly has provisions in there that are positive rather than improve what we have mystifies, I think, everybody in America. You don't throw out the good with the bad. You improve it all, as any Vermont farmer would know. Vermont has known that, and it has had a tradition through Republican and Democratic governors with Democratic and Republican legislatures that our job is to improve. It's to have more access, more affordable care, and better outcomes. The history begins with Dr. Dinosaur, Governor Cunin, and Governor Dean. It extends through the Blueprint for Health, the waiver for Medicaid that gave us flexibility as a state to deliver more for less. It included the Catamount Health Program. These have all been incremental steps. What Governor Shumlin knows is the time for incrementalism is over. We need a comprehensive system that is going to provide access, that is going to contain costs, that's going to be better for families and better for businesses. The goal we have with Senator Leahy and Senator Sanders' leadership with the legislation that Bernie has introduced in the Senate and that I am going to be sponsoring in the House is a continuation of the Vermont tradition of leadership. And what we've shown in Vermont is that by working together to improve what we have, not throw everything out and get bogged down in ideological debates, we can actually improve outcomes, lower cost for Vermont businesses and for Vermont families. That's the goal of the waiver. And the waiver is timed to go into effect in 2014. A lot of us would like to have had that go into effect yesterday because that's when federal reform will go into effect and there'll be funds available to help make the transition. And one of the questions that's come up is with a Republican Congress that wants to repeal health care, how will we get a waiver? I've been working with colleagues who don't agree with me about single payer. I support single payer. And my argument to them is this: why not let the states experiment? Why not let the states achieve the goals of more affordable care, better access, in ways that those states find the best way to get from here to there? So it's a states' rights argument. And what we have seen is that the states often have been the ones that have been the leaders. And in the current health care bill, Vermont leadership is very prominent. The Blueprint for Health is contained in the current health care bill that the Republican leadership wants to repeal. Accountable care organizations, really something that came out of Vermont and New Hampshire working together, is in the health care bill. Many of the insurance reforms that are in the federal legislation were pioneered here in the state of Vermont. So this is a continuation of the Vermont leadership. I salute Governor Shumlin for his forthright advocacy of the potential for Vermont to make progress and lead the way in the country. Thank you.